And I know also I have people who don't know me just yet and don't know my system just yet, don't know my philosophy just yet. And you are the ones that I'm going to be sharing with you what my system and my philosophy is all about. I'm going to give you a presentation, and after presentation, you will be able to ask me questions. I will give you value during this call because usually the webinars are, I take webinars, they're usually wishy-washy, they're very salesy. I promise you this is not what we're going to be doing in here. I will definitely talk about my product because I adore it and I believe in it, but I will also give you certain things that you will be able to take away with you after this call, so you would get the value. So what I do, I'm an esthetician. I still admitting, I'm sorry that I'm looking up so much, but I still am meeting people. So we're going to go into the presentation right away. And as I told you, if anything is not clear, I'm going to answer all your questions. Also, I have on the paper the most frequently asked questions that people ask me on internet, on Instagram, and I'm going to answer those questions too. So I'm going to start with introducing myself. Right now, I will ask you to tell me if do you ladies see the presentation slide? Do you see? Perfect. Gina, thank you so much. You're helping me a lot. I really appreciate it. So, ladies, my name is Helena Pahava, and I am third generation esthetician. I've been doing this work now for 33 years, and I love it more than anything. And probably one of the most things that I'm grateful for in life, especially to my ancestors, is that I kind of inherited this work from them. I inherited it, I think, with the blood and also with experience, and that's all I have been doing. And until today, I find it exciting. It's interesting. We can cater to people, we can serve people, and we also can serve ourselves. So I was born and raised in Republic of Georgia. For those of you who don't know what it is, in the city of Tbilisi. Republic of Georgia is located between Russia and Turkey. And we are our own country, and we have our own culture, our own language. This is just our location. And I was born in there, and as I told you, to the family of esthetician, and I was raised in there. And by the time I was 18, we emigrated to United States of America. So I live in America for most part of my life. I absolutely adore it. And it became my home. But actually, I feel myself like I'm this mixed of the Georgian and American, and it's a culture of its own. So my main education I got back in Republic of Georgia, but of course when I came to America, I continued my education. I have to tell you that I still continue my education. I'm 52 years old. I've been doing it for 33 years, and I still continue my education because, as everybody in the world, I don't know everything, but I certainly aiming there. I certainly want to know everything. Lady, somebody has a microphone on. I would just have to mute it terribly. Sorry, give me 1 second. I'm muting it. Perfect. And then when you're going to ask me questions, all you have to do is unmute yourself and you will be able to ask me a question. So I came to United States. I continued my work. I started to learn in here the new techniques, different techniques than from what was back in my home country, my homeland. And over time, I developed my own system. I'm just going to admit one more person. I developed my own system. So what is my system all about? Do you ladies see the next slide? Gina, I'm sorry, I keep asking you questions. Thank you, Gina. I really appreciate it. So what my system is all about, in my system, in my facials, in my practice, because at this moment I used to do absolutely everything as any other esthetician, but now I do only my method. There are 3 things that I must pay attention to, and I must combine into the flow of the work. This is the real results on client's face. So in the end of the facial, every client that comes underneath my hands is lifted, rejuvenated, and also cared for. I tell them how to maintain it. So clients' results on the face is non-negotiable. If you don't see any results on client's face, something didn't go right. Something was not done right. The recipe that I teach my students brings results on the client's face over and over and over again. It's a tested recipe. Now, of course, it depends on the age of the client. On very young client, you're going to see slight results because there is not a lot to fix. On the older client, it's going to take a couple of facials before you see significant results. But on the middle-aged people, like I would say between 35 and even 65, it really depends how this particular person goes through the process of the tissue aging, that you will see results right after first treatment, and everything is already put into the system of the facial. The second thing that is extremely important for me is the protection of the health of the practitioner. If you're not healthy, if you're not enjoying your work, if you're not protecting your hands, if you're not protecting your back, if you're not protecting your nervous system while you work, your client is not going to get 100% of what you have to offer. How do I know that? I have done it. I have done the work that I was not thinking about myself at all. Don't forget, I'm coming from former Soviet Union, and I worked for my family for 18 years. And I love my family. They were excellent professionals, but they completely didn't care about the professional. They only cared about clients. So I was booked 10, 12 facials in one day. Nobody adjusted the bed for me. The chair wasn't comfortable. It was the regular chair. By the way, girls, right now, while I remember, if you're working with clients, use the settle back chair. You can go on Amazon, check out the settle back chairs, make sure they're high enough, and make sure that from now on, your number one investment is a settle back chair in your treatment room. It's going to save your back. It's going to save your low back. It's going to save your posture. So before I go on, I just want to make sure that I said that so I will not forget about it. So protection of the health, also the protection of the nervous system. I, unfortunately, am prone to anxiety and panic attacks, unfortunately for me. And what I've learned and what I realized that during the facial that I provide to my clients, during my work, I can regulate my own nervous system. And in fact, part one, lymphatic drainage, and I will tell you why I start with lymphatic drainage because I know that question is going to come. And part three, buccal massage, and then we will talk about that separately too, are meant to take care of the nervous system of the client and my own. I go into the Zen mode. I completely relax. I use very light hands. We're going to be talking about pressure also, of course. And I reset my own parasympathetic nervous system's response. So I work from the parasympathetic nervous system versus working in sympathetic nervous system. What it did to me, it is absolutely healing experience for me. So every facial that I provide to my client, I heal her because we work with her nervous system. Very important to take this in consideration because the cranial nerve number 7 goes behind the ear and comes as a 5 hands and completely controls the face. Let me stop sharing for a second. Okay, so when we work with the clients, speaking about nervous systems, if you really want to lift her face, you have to understand the cranial nerve number 7 goes behind the ears from both sides, of course, and completely is in charge of the face. It controls the contractions of the face. For you to be able to lift her face, you have to be able to work not only with her heart and soft tissues, which is understandable. You have to be also be able to work with her nervous system, because when she relaxes, all the healthy processes automatically kick in. And now you don't have to fight with contractions because she allows you to work with her tissues without fighting against the tissues. So this is something that we definitely approach in this particular facial. And this is something that I approach about myself. I have to make sure that after every facial, I come out relaxed. And it doesn't matter. It's my first facial of the day or it's my fifth facial of the day. It's been years. I don't take more than 5 facials a day. The days of 10, 12 facials are long gone. But unfortunately, in that time, I didn't know how to take care of myself. Now I know how to take care of myself. And I always check with myself. I really think that you should do the same thing. After each facial that you provide, check with yourself. How do I feel? Do I feel relaxed or I feel tense? Am I tired? Are my hands tired? Is my back tired? And if the answer is yes, you're not doing something right. You're doing something wrong. So you will have to readdress the positioning of your body. And the most importantly, that I see with a lot of my students is people don't breathe while they are working. You have to watch your breath. And the most interesting thing is not everybody even knows how to breathe. And when I tell to my girls an in-person training, expand to your diaphragm with a breath. It takes us a while to teach the body how to expand the diaphragm and how to release the diaphragm. And don't worry, once you know how to do it, you're not going to do it loudly and you're not going to breathe directly on your client. Because a lot of my girls say, oh, I don't want to breathe on her. You don't have to breathe on her. There is the way to do it when you can breathe without breathing on her. That's why when I begin the facial, I actually begin the facial breathing together with the client. So we get aligned. Her nervous system comes down, my nervous system comes down, and now we can create alliance during the entire facial. So the practitioner's health, not only physical, but also in what state of nervous system professional is working, greatly impacts what result your client is going to get in the end of the facial. You become one with the clients. That is 100% right. I don't know who wrote it, but it's 100% right. You become one with the client. You give in serenity to her. You feed her with calmness in first. You breathe with her. And the good thing about it, time goes so fast that you're like, oh my God, what happened? Where did an hour go? And by the end of the facial, you are completely restored, relaxed, and soothed. I had a very interesting experience. I had a in-person class, private class. I used to do group classes. I stopped doing them. I don't do group classes anymore because it's bad for my nervous system. I'm always worried that I missed something, I didn't see something. So I stopped giving group classes. I take maximum 2 people in one class. They work for each other, on each other. So one works, the other receives, or I have 1 people in a class. I don't do it in any other way. So I had a class with my student and I kept telling her, I don't know if she's here, Claudia, breathe. Claudia, breathe. And you know what? When you are in the learning environment and I'm sitting straight on top of you, I completely understand that she wants to do the movement exactly right. And she was forgetting to breathe. And I was, honey, we have to breathe. We have to breathe or you're not going to relax her. See, when you're not breathing, you become contracted, you become jittery. And that electricity goes straight into the body of your client because you're so connected to her. She feels it and she becomes tense. But for us to have results in the end of the facial, she has to be relaxed. So we work against them when we are tense and when we are not breathing. So this is what was very interesting. I'm telling her, Claudia, breathe, Claudia, breathe. She breathes for a little bit, she stops. And then the model on the table, she turned to her and say, you know what, Claudia, when you're breathing, I'm breathing with you. When you're not breathing, I feel uncomfortable. And that sentence completely changed my students' understanding of the importance of the breath. All of a sudden, my students started to breathe and I didn't have to correct her anymore. So for the client, the girls will do it. For themselves, they may forget. So remember, when you're not breathing, when you're nervous, when you're tense. We are so closely attached to them, especially when we go inside the mouth. They receive the information. And if they're going to receive information of tension and tiredness, you're not going to achieve results. They have to receive information of calm. And then the face lifts naturally without you even working on the face yet. It's incredible when you're going to start. My dear friends, unfortunately, during the live Zoom, we had technical difficulties and our Zoom got disconnected. We did reestablish the connection with people who were present in a live Zoom, but it did not got recorded. Our main body of work didn't got recorded. But I did promise you that I'm going to come to you and they're going to talk to you and I'm going to send you recording. And therefore, right now, our Zoom is already finished, but I am back in front of my recording camera and computer, and I'm going to record for you all the information you need to know that you are looking forward to learn from me today. So the first part is actually from the last Zoom, and this part I'm just continuing what we have, where I have stopped in the last Zoom. So as I say, this method is created to bring the results on your client's face, and we're going to be talking about how we're going to bring results to the client's face. There is a very specific recipe that we use that always brings results on a client's face over and over in any age group, and that recipe is embedded in this facial. The second thing that I always look out for is the health of the practitioner. What do I mean by that? The wrists, the back, the neck, the nervous system, the posture, everything we have to consider, because we work about 5 hours straight in a day, and our work is a physical work. And if we don't know how to take care of our body, if we don't know where to take your time and allow your hands to rest, where to put a little bit more pressure on your hands, but how to use your body while you're doing it, then injury will be inevitable. So one thing I'm going to tell you right now, one of the best things you can do, if you already are not working on a settle back chair, settle back stool, start working on a settle back stool. It might take a little bit of time for you to get used to it, but oh my God, once you get used to it, the relief that it brings to your back is priceless. Where can you find settle back stool? Go to Google. Just write in a search saddleback stool, and it's going to give you a variety of saddleback stools. Find the one that's best for you. I want to tell you that I like the one that does not has a back, because I want my own muscles to hold my back. But if you want a little bit something to rely on, you can definitely use the saddleback stool with the back support, and start working on that. And that alone is going to bring relief to your body. Also, the first part and the third part of this facial are designed specifically not to be abrasive on your body, on your hands, on your wrist, on your back, and also on your nervous system. And the way we start this facial, we breathe together with our clients. Number one, to establish connection, to work in alliance, and number two, to soothe our own nervous system as much as we're soothing them. If after facial you are tired, you're exhausted, your body aches, it means that something was not done right. Because if you perform the facial right, your body going to feel comfortable, and you're actually going to feel rejuvenated, because you were in a very zen mode. You were connected to your client. And the third thing that we are paying attention to, so we have results on the client's face, we have a preservation of our own body and the business. Why do we need to take care of our business in most ethical way possible? Because it's the only way that you feel comfortable with and your business is long lasting. But why do we have to pay attention to the business? Because if you don't have a good flow of business, and if you have a gaps in your schedule, it's very difficult for you to keep your nervous system calm. If you have your team salaries to pay, or your business rent to pay, or your front desk to pay, and you have difficulty with the cash flow into your business, then it will be very hard for you to relax enough to help your clients to relax. And remember, the results, final results on the face, the lift on the face, deeply depends to what extent you can relax your client physically and emotionally. And it starts with you. If you're not relaxed, if you're not comfortable, and you're so intimately connected to the face of your client, she will feel that stagnation. She will feel that stress electricity from you, and she's not going to be able to relax herself. And in the end, you're not going to have a good result on her face. So that you have seen those slides. We're going to the next slide right now. So in this slide, we had results, health, and business. This is what we have to take care of first. And now we're going to go to the next slide. So the next slide is real results on your client's face. They have to be bringing a very visible difference. Right here, you have a before and after of my client after one session. And that was when I saw her for the first time. Her face was quite responsive, which I'm very lucky. Also, she was in the age group that is the easiest to bring a visible result, but results can be dramatic, even after just one session in this method. So we have an improved blood tone, we have a better circulation. So basically what we are doing, we amplifying the healthiest function of both heart and soft tissues on a client's face. We also relax the nervous system. This is very important because the cranial nerve number 7 starts at your cranial, goes behind your ears, and it has 5 handles from each side of the face. When you actually are nervous, that nerve contracts. When that nerve contracts, it doesn't allow your tissues, soft and hard tissues, to work in an optimum level. You don't have a proper blood circulation. You don't have a proper fascia sliding function on your face. The oxygen doesn't come well into your tissues, and lymphatic drainage does not happen naturally. So, for us to restore the healthy function of the tissue automatically, naturally, we have to make sure that cranial nerve is relaxed. And the only way to relax this cranial nerve is just to make sure that when she's with you, her body functions from her parasympathetic nervous system. She is completely relaxed. Her complete relaxation is your first step to the facelift. That's why this facial has a specific recipe to how to bring the clients into the treatment room and how to say goodbye for them. Every single step was designed to be consistently catering to your client's facial embedment. When I bring the clients to the treatment room, first of all, I try to come out myself and greet them myself. When I'm running late, the front desk brings the clients. That happens too. But if I have an opportunity to come out myself, I come out myself. And I always watch my posture. Because when you come out to the client, you want to show her that you are confident, that you're energetic, that you're willing and ready to work. If you don't watch your posture, you're going to look tired. And what woman would want to go with a person who is already tired and make them work on herself? Women usually are very empathetic and we care about our people who work on us. So when you come out, you want to show her that you're energetic, you're ready to work, you're willing to work, you're interested in work. And your posture communicates all the signals to her. And now she knows that you're willing to do it and you're happy to do it. And she's relaxing. The second thing I always do, I absolutely make sure that before she lies down on the table, I sit right in front of her. I'll tell you why. Because it's very common in our practice to greet client into the room, tell her to lie down, change, lie down. Then we walk in and we start asking questions. But when she's lying down and you're standing on top of her, unknowingly, subconsciously, her nervous system goes into defense position. Because you're on top, she's lying down, and she needs to defend herself from you. If you're going to establish connection with the client while she's sitting and you're standing right in front of her, in the very beginning of the facial, By the time you're going to enter the room, when she's lying down already, you are already somebody she knows and trusts. So her nervous system is not going to reject you. And her cranial nerve number 7 is not going to contract her face. So as I told you, you start relaxing and working with her at hello. This is very important. You don't want to waste our time. You want to make sure that by the time she's going to stand from the table, she looks lifted. And in that recipe, every single step matters. Protecting your own body. Most important thing, because our work can be injury provoking and it could be pretty exhausting for your body. So even if you have only 5 people a day, and sometimes we have to take more and sometimes we have to take less, even if you have 3 people a day, with each person, you have to make sure that number 1, you are breathing. What I have noticed in my in-person work, my students are not used to breathe deep during the work. It's a huge mistake, and it can impair the health of your body and of your cardiovascular system, especially when women enter the life change phase in the perimenopause. Hormonally, everything is changing in the body. That we have those sweats, the hot flashes. And if you stagnant and if you work in a very contractive way, you actually can hurt yourself internally. So number 1 thing that we have to always remember, pay attention how you breathe during your work. Right now, whether you're going to do this method or any other method, pay attention if you breathe deeply while you work. The second thing, make sure that your body feels comfortable while you work. I had a very interesting instance. I was teaching a very big class, and I saw that one girl in that class, I don't teach, by the way, big classes anymore. I do only private classes because I get uncomfortable with the big classes. I don't know what happens in one side of the room and I'm on the other side, and I don't have teaching assistants. I need to see everything myself or I cannot approve it. And one girl there, I paid attention. She was not comfortable. And I was thinking, when is she going to change her position? Because she's clearly not comfortable. Her chair is way too low for her to work that way. So shoulders are up, her hands are like this. And I did correct her specifically. I just wanted to know when she will notice it, when she will put her body in comfortable position. After a while, my nervous system couldn't handle it. And I said, honey, are you comfortable working like this? And she took a second and she said, no, I don't think I'm comfortable. I said, well, bring the chair up. And she brought the chair up. I said, does it feel better that way? She says, oh, yes, it feels better this way. I said, why didn't you change your position? Why did you keep that way? You clearly were uncomfortable. She said, oh, I don't know. I didn't register it. And that happens over and over and over again. Make sure that you register. How do you feel while you work? Do you need to bring your chair up or down? Do you need to bring your table up or down? And sometimes not everybody has a table that are electric, but see what you can do to make yourself comfortable, as far as maybe you have to wear very flat shoes if your table is unchangeable. Or maybe if you're a shorter person and you have to work with your shoulders up, you want to wear a little bit of the heel or a platform when you're working, so you could elevate yourself to a comfortable position. And remember, those massage tables, they are adjustable. You can unscrew and screw them to your body's comfortable position. Pay attention on that, because a lot of girls walk into the treatment room and they just go to the table as it is and they start working on the table, and entire day they are in uncomfortable for them position, but they're not paying attention to that. In the long run, it can impair the health of your body. So the next time you go in treatment room, make sure that you like the temperature. If you have open window, get yourself a good air in there. You can use the air purifying systems to make sure you breathe correctly. Adjust your table to your comfort. Adjust your chair to your comfort. Make sure you're comfortable. And one more very important thing, do not wear very tight bras, because tight bras don't allow your diaphragm to move properly. So make sure that your bra is loose when you're working. It's going to be better for your cardiovascular system. You have to take care of yourself first. exercises that you need to do before you start working and to maintain your own system, we provide in our course in a great detail. So that I'm not going to be talking right now in here because I really reserve it only for my students, because we go there in detail, they get the whole system and they apply it on themselves. But even without that, as I told you, make sure the height of your chair, height of your table, the air in your room, what you're wearing on your feet, what you're wearing on your body, your bra, everything you have to pay attention to because it all matters. Next one, we have the practice that is full and you're building your full practice. The thing is, as I told you, for you to give the best possible treatment for your client, you have to be in best possible shape for yourself. And it's very difficult to be in very best possible shape for yourself if you have a clear difficulties in making your book full. You're worried about finances, and clients feel it. That's why in this particular course, we also teach you how to bring clients on your table. And after the completion of your course, I put you, once you get certified, we're going to talk about it a little bit further down in the Zoom. I put you in front of the bigger audience so you could collect clients, so you could start the clients. So this is my map. Online course, for example, costs $2,500. If you charge for facial $250, which is very medium price for this facial, then in 10 facials, you're going to pay for the course, and the rest of money that you make is going to go to your business, to your pocket, to your family. So I did all the calculations, and I know for a fact that once we certify you, we're going to send you some clients. Hopefully those 10 people you're going to take as soon as possible, and the course is going to be paid for, because for me, it matters. I want you to have your return on investment as soon as possible. And we help you with that also. What do we need to do to have a sustainable, progressively growing business? We need to have three things: skill, attention, and exposure. And we're going to be talking about them separately. Skill. What does skill mean? Skill means that every time you give facial, you can predict that you're going to have a good result from that facial, and client is going to see the difference on the face. We teach you in this course exact recipe from the hello to goodbye to how to do it. Attention. Attention is a very interesting thing. Again, I'm going to tell you a story further down in the Zoom about attention. Attention is how much you can concentrate on your client, how much you can concentrate on your job. And exposure is how many people know about you, how many people see you, how many people come to you to receive the treatment from you, how many faces you are touching. And let's start with the skill. So, skill is the recipe for the facial that makes difference on a client's face. We always start with the lymphatic drainage, and I'm going to answer you to the most common questions about lymphatic drainage. Then we go to the superficial muscle work and surrounding facial work. Then we go into the buccal massage, and then we go into the finishing part of the facial. We absolutely always start with lymphatic drainage though. The face by itself is not one straight two-dimensional thing. Face is made from many, many, many layers. And the first layer, the pillar of our face, is actually our bone. It's very important to consider the bone work within the facial. Why? Because when bone is shrinking, and it does with age, all the surrounding face tissues are falling on a bone like oversized sheets on a small mattress. And it's very difficult to make a big difference in a face when that already occurred. Unfortunately, with age, our bone does shrinks, but there are ways during the facial that we can do to prevent the shrinkage of the bone. One of the things that we do, we massage epicranial aponeurosis. We actually apply some pressure so we could cause something in nature called piezoelectricity. When we apply pressure to the bone creates piezoelectricity, and that electric charge communicates with the lower left. So the bone is made from three parts. We have periosteum, is the top part, the part that we're touching. Then we have a cortical bone. A cortical bone layer is the middle layer of the bone. And then we have a very last layer that's underneath, and it's called trabecular bone. And right there, bone provides a cells that cause osteoblast. And those cells help to rebuild the bone. Just like our skin, our bone goes through the process of the disintegration to desquamation process. So it grows, and the last layer kind of falls off, and the new layer of bone is coming. This is how we grow. But unfortunately, as we age, bone gets thinner, so it exfoliates yourself out of the bone, but the new cells don't form fast enough to give you the new layer of the bone. And that's when bone shrinks. So when you apply the very specific pressure on the bone, you create piezoelectricity. Piezoelectricity creates cells called osteoblasts. And those cells are preserving the diameter of our bone because they rebuild it. On top of the bone, we have deep subcutaneous fat that we have to feed with blood because it's the fat part that takes all the impact. Then we have a fascia, deep fascia. Then we have a muscle fibers. Then we have a medial fascia. We have a superficial fat. We have a superficial fascia. We have a skin. In between, we have the circulatory system, our blood, the lymphatic system. We are all seeing that green things in between. We have also the space between the fascia. So fascia could have a healthy gliding. There would be no stagnation. So we have a lot of processes that goes through the face, a lot of layers of the face. And during the facial, we have to cater to each and every one of them. And we have to do it in a very specific pattern so that what we do would be impactful and effective. If we're going to switch the pattern, we're not going to have the same effect. So that's something that I wanted to talk about. And we always start our facial from lymphatic drainage. Lots of people ask me this question. Why do you start the facial with lymphatic drainage? Why don't you do it in the end? And this is the answer. Our lymph nodes. Let's talk about lymphatic system, by the way. Lymphatic system is a pure system of our body. Why do we need to do lymphatic drainage? So we will take accumulated fluid in a face away from the face because that fluid prevents the proper function of the tissue. It pushes actually on the periosteum, which is not healthy for periosteum, and it has a visible pockets on the face that make face less smooth, and it gives age to look for the face. It also in a poor way impacts our skin. So we can manually, while we do lymphatic drainage, so we could manually remove that fluid. But let's look at the little nuances, details, and intricacies of lymphatic system by itself. Lymphatic system works in three parts. We have a lymphatic capillaries, and those are like a little tentacles, and they absorb the fluid from our extracellular water matrix into lymph vessels. Lymph vessels are the tiny little tubes that are moving fluid from one place to another. They work in a very rhythmical way, and they have one side opening that pushes the fluid. Lymph always moves towards the heart from bottom up, from top bottom. So now we know that we have fluid in our lymph vessels, and lymph vessels move the fluid to the lymph nodes. Those little green dots that you have in pictures, those are lymph nodes. You see them right now in the picture. Those are lymph nodes. Inside those lymph nodes, there is a process of filtration. The clean fluid goes back to make up the blood, and the fluid that wasn't clean goes back also into our system. We push it through axillary cavities, and in the end, our body reduces that fluid from our body. Now, why do we need to do this process before we start massage? Because both lymph vessels and lymph nodes are superficially placed there right under our fingers. They are very fragile, actually, structures. If you're going to press on them too much, nothing bad is going to happen. But the lymph vessel is going to collapse, and lymph node is going to release the fluid. So instead of moving the fluid away from the face, the fluid is going to be released. All the tissues, soft tissues around are going to be congested. They're going to receive that fluid until the fluid is going to be back absorbed by the vessels. And you're not going to be able to move the fluid. Our job is to move the fluid away from the face. So we need to work alongside these lymph vessels. So what we need to do, we need to touch very lightly, move, lightly move. And when you're doing it for a long time, you actually see underneath your fingers exactly how to move the fluid because you feel the fluid underneath your fingers. If you're going to press too hard, the fluid is going to be released. It's going to be congesting all the soft tissues. You're not going to be able to move it. The vessels and the nodes are going to reabsorb the fluid a little later, and we did absolutely nothing for improvement of the face. If you're going to start the facial with a massage, inevitably, whether you want it or not, you are going to press on the areas of the lymph nodes and lymph vessels. The fluid is going to be released. If you're going to do lymphatic drainage in the end of the facial, you're not going to be able to move the fluid. You need to catch it before something was pressing on that area. So you visibly going to remove the fluid and the face is going to appear lifted. That's why lymphatic drainage should be done in the beginning of the facial. If you're in America, you have to do the cleanse first. I have to address the cleansing part because that's the question people ask. They say, how come you say that first cleanse has to be done with a light hand? And the second cleanse, you can do however you want to. What people are, maybe I'm not communicating properly. When I mean first cleanse, it's not a double cleanse. It's not second part of double cleanse. We remove, if person has makeup, with a micellar water, we remove the makeup. Then we're doing the cleanse with a creamy cleanser, very light cleanse with a cool towel because I do not want to start any processes. Then I'm doing the lymphatic drainage and then I go ahead and do massage. And by the end of the facial, I do the second cleanse because I need to remove the oil. By the way, the oil that I use is a grapeseed oil, always for every massage, whether it's superficial or it's intraoral. And I remove that. That's what I mean by second cleanse. I don't mean the second part of a double cleanse in the beginning of the facial. In the beginning of a facial, we are not double cleansing. We touch the facial structures as little as possible. We quickly do the one cleanse to remove the dirt, debris, the dust, the pollutions, everything that's on the skin. We want to remove that. We want to use a very cool towel. We are removing it and we're going ahead and doing lymphatic drainage. If you're in Europe, you can start with lymphatic drainage actually without touching the face. Once you did the lymphatic drainage, you can go ahead and do the cleansing. But if you want to cleanse first, the first cleanse of the facial, not of a double cleanse, of the facial has to be done with a light hand. The second cleanse, in the end of the facial, you can use whatever pressure you want, whatever type of cleansing you want, it's all fine. First cleanse and the second cleanse, I like to use a creamy cleanser. I like to use cleansers that mimic the lipid barrier of the skin. So we have ceramides, cholesterol, and fatty acids. That's what makes the lipid barrier of the skin. And I like to have a cleanser that mimics that trio, ceramides, cholesterol, fatty acids. If you're going to go to Google and you put in a search the cleansers that mimic the natural fatty lipid barrier of the skin, they're going to give you several options. Look at the cost, look what you are more, but it's the best cleanser to use. I actually use those cleansers for every facial because I just don't like stripping cleansers. I like very hydrating cleansers. And if you're going to look for a cleanser that mimics the lipid barrier of the skin, you're going to get the texture and those ingredients that's going to really work for the skin very well, especially in this facial. So I hope I answered the question about why I start with a very light hand, why don't I press in the beginning, and once again, when I mean the first cleanse, I mean the first cleanse of the facial, not first part of double cleanse. It's a single cleanse in the beginning, and then we're cleansing again in the end. After we did lymphatic drainage, we're going to work with superficial muscle work. We absolutely do not touch the face in the very beginning because we need to prepare all the surrounding face tissues for the lift. If we are not going to make space in epicranial aponeurosis, if we're not going to relax pre- and subauricular contractions, if we're not going to relax platysma in the chest, when you're going to work with the face is not going to be received with surrounding face tissues, and your lift is going to only stay there for a couple of hours if you're lucky. So what we need to do, we need to prepare all the surrounding face tissues before we go to the face. That way, when you're going to actually work with the face, the surrounding face tissues are going to receive the lift. They're going to be ready for the lift. One of the most important things in working with the face is working with a SMAS. SMAS is a very important area. It's a superficial muscular aponeurotic system. Superficial muscular aponeurotic system. Remember that word because it's so important. It starts at the chest, goes through platysma, and then it hugs your face from two sides. It's like a scaffolding of the face. Very often I see on Instagram, people work very strong with a strong hand. They try to work with SMAS. Girls, SMAS is flexible from one side. It's a thick fascia. It's flexible, but in the same time, it's not that hard to stretch the SMAS. So if you're going to be working with a strong hand and over the SMAS, you're going to bring the inflammation to this area. Inflammation is going to cause fibrosis or production of collagen and other extracellular matrix that makes a glue-like material that glues hard and the soft tissues together. And what happens in reality, it glues the SMAS. And SMAS has to be mobile, excuse me. We need to have a space between the tissues so the SMAS would be mobile and will be able to hold our faces up. If we're going to work with a strong hand, and if we're going to put inflammation in this area, that's going to bring fibrosis, which means the tissues are not going to function the proper way. Instead of bringing lift to the client's face, you're going to bring droopiness to the client's face. So what do we do when you work with the face and you are very obviously stuck? You stay there, you take your time, and with a very soft hand, you remove the stagnation. We, of course, address all of this in our course in step by step, in very detailed way, but I want you to have that piece of information because no matter what modality you do, when you work with face, you cannot have a strong hand because strong hand is going to bring you inflammation. Inflammation is going to bring you fibrosis. Fibrosis is going to bring you ptosis. You have to be very careful. The next thing we do in our modality is intraoral buccal massage. This is my favorite thing ever because it gives such a difference on the client's face. But intraoral buccal massage can also harm if you use strong hand in there. When people come to you, sometimes they tell you, I have TMJ. It's very funny for me because everybody has TMJ. TMJ is temporal mandibular joint. That's what TMJ is. That's it. But when they come to you and say, I have TMJ, what they really have, if they have stagnated TMJ, they're already stuck. Everything is already there, has inflammation. If you're going to go there with a strong hand, you're going to aggravate that area and bring even more inflammation. We remember that inflammation causes fibrosis, that scarred, stuck tissue, and fibrosis causes ptosis. So when we work intraorally, we have to be extremely careful. We have to use very light hand. And we always have to ask, does it feel good? It doesn't hurt. Because you don't know, there's a lot of inflammation, person may hurt. The funny thing sometimes happens when you give intraoral massage to a client. Client starts to cry. But they're not crying because you're hurting them. Ask them, are you in pain? Am I hurting you? They will tell you no. They cry because they have emotional relief. It's a very healthy thing. Don't ask them questions. Do not stop working on them. Allow them to go through that process. This is a very healthy process for them. Just make sure that you're not working with a strong hand because as I told you, the strong hand is going to hurt them. You have to go inside the mouth and you have to be very attentive and you have to pay attention to nuances. And as the tissue is going to get softer, then you can start manipulating inside the mouth. Inside the mouth is a very, very delicate area. Always use oil when you go inside the mouth. If you do medical massage, you don't need to use oil, but we don't provide medical massage. We do it for aesthetic purposes only, and we do not want to irritate the mucous membrane inside the mouth of the client. So cover your gloves with a grapeseed oil just to be safe. Again, buccal massage is extremely effective. Depending on regulation of the state that you are in, you have to look into it. Most states you can do it if it's not medical massage. But sometimes client comes to you and they have implants that I had recently also. If you cannot provide them buccal massage, repeat the second part twice. And then you're going to still provide them this result. But remember, if somebody does facial that has a buccal massage in it, and somebody does facial just as well that doesn't have a buccal massage, the person that has a buccal massage will get much better result. Visible lift on the face. Our last part is the lifting techniques, and it's also where we're putting our skincare. I like very simple skincare. I take you through every skincare step that I have in a course. I tell you what ingredients we use, why do we use these ingredients. As I told you in this course, I'm teaching you absolutely everything from hello to goodbye and everything in between to have a very successful facial, both structurally, architecturally, and also with the skin. And one thing that we do that absolutely very special is the fact that we provide our clients with facial exercises. Why do we do it? Our brain has a function that's called brain's proprioceptive integration. Brain proprioceptive integration. What does it mean? For brain to recognize the change on your face, it has to be exposed to the change over and over and over again. So when we're changing the architecture of the face, when we try to leave the face, when we try to relax the face, when we fix the posture, because it's such a big part of the way we look, the brain has to recognize it as a new permanent. If brain does not recognize it as a new permanent, it's going to bring it back to what it used to be. So for us to produce consistent, permanent effect on a client's face, we have to equip her with exercises that she can do on a daily basis, 12 to 15 minutes, for brain to recognize that change. And that exercise I provide to you. As I told you in the beginning, I'm a esthetician for 33 years now. I worked with my family for 18 years. My grandmother, my mother, my aunt, everybody was esthetician. But I also went to Academy of Choreography. I used to be in a young age a ballerina. So all the exercises that I made for this particular modality, I based on the knowledge from the classical ballet, alignment, biology, the structure, everything that you have in there, in those exercises that I produce for you is very classically, appropriately, academically put together. I never put people just in stretch because I know it's going to cause injury. We warm up our muscles first. So the exercises that I provide for you inside the training are done in a very safe way. They are done in very classical way. They are done in very correct way. You're not going to cause any injury for your client, and you're going to give them architectural support. So the brain would recognize the change as a new normal, as a new steady, and hold that change inside the body. If you're not going to incorporate the brain in that process, in 2-3 days, everything is going to go back to what it used to be. Because brain is going to bring back the position the way it used to be. But if you're going to keep in mind that you have to teach the brain there is a new normal in the structure, in a short amount of time, you will see a great actually difference in your client's face. So we are not working only with this, with the skin. We are not working with the facade. We're working with entire human being. We're working with the brain. We're working with the nervous system, with the lymphatic system, with the vascular system. We incorporate everything and we work in a very safe way because we understand that we can also hurt the clients, especially when it comes to working with the neck. There is very safe procedure to work with the neck. We never go very strong with sternocleidomastoid. We understand the jugular vein and vagus nerve is in there, and jugular returns blood to the heart from the left side of the venous angle. So everything is already thought about. Everything is already prepared for you to have the safest and most effective facial possible. Attention. And now I have a little story for you. So there are two Carnegies out there, Dale Carnegie and Andrew Carnegie. And Andrew Carnegie is the man actually to build the Carnegie Hall in New York City. He was American industrialist and he was very successful one. So when he started to work, the government realized that he grows very quickly and he becomes very prosperous and very successful. And they checked that he was paying taxes and he was paying to workers, so there was nothing wrong in a legal way. So they brought him for questioning because they were interested what is going on, how he makes all this money and grows business so quickly. And his answer was very short. He said that his attention span is 90 minutes. Now, what does it mean? It means that he can think about one subject only for 90 minutes. If you can do it, you can conquer anything in this world. Now, why do we need to know about as a facialist? Because when you work with a human body, when you work inside the mouth, you have to have a laser focused attention and alignment. If your hands are in the mouth of the client and your brain is in a supermarket or in a laundry room or in Netflix, you're not going to give client the results than if you are completely connected with the clients. And that takes attention, especially in this system, because we work with a very light hand. Again, we don't want to create inflammation and fibrosis and ptosis. So we have to work with a light hand, but we also have to align with our client. And that takes ability to have an attention that's prolonged, to keep attention on one subject, to notice the nuances. That I also teach you one of our Zooms, our attention Zoom, and we do the exercises that teach and train our attention. So you will be able to really manipulate tissues of the client's face in a light but very effective way. And then the exposure. If you are the best facialist in the world and nobody knows about you, you have no faces to work with. You serve nobody. So you have to have exposure. How do we help you with exposure? After you complete our course, first you have to get certified. I will tell you in a minute what it takes. And then we take you and put it in front of our audience so we could send you clients right away. First of all, I want you to replenish your return on investment right away. It's my goal for you to make money from this course, at least what you have spent it on me as soon as possible, and then right away to make extra. This is very important for me. And secondly, also because of course I want you to gain the name in your community and to build a great business. So that takes exposure. And we help you with exposure. The only thing I want to tell you that just because you took the course, it doesn't mean that you're going to get certified. For you to get certified, I need to see your work. If you come in a person work, it's going to be very easy. I'm going to see how you work. I'm going to correct you, and certification is much easier in an in-person course. But if you do the course online, this is how we work. In the beginning, we send you the entire curriculum. I never close it because I personally bought courses that I couldn't address right away. And when I went back to those courses, they were already closed and I had to buy them again and I didn't like it. Therefore, I never close ever course curriculum. Secondly, we have 5 Zooms: orientation, facial exercises, attention Zoom, skincare Zoom, and Instagram Zoom. We have 5 Zooms and they're open during the time of our learning plus 4 months. And thirdly, we have a private chat. And the chat is open the month of your learning and 4 more months. And in that private chat, you can send me questions and I answer my girls right away. I don't make my girls wait because I don't want you to be discouraged. And also you send me small videos of your practice and I look at your hands and I look at your fingers and I look how you work with client and I correct you and send it back to you. And sometimes I tell you you did great and you don't need correction. Sometimes I tell you do need correction. So that all depends. And after I've seen every move you made, and it's not difficult because it's only 1 hour facial, only then, when I know that you're doing it correctly, I certify you. Why? Because as I told you, after certification, I'm going to bring you to my Instagram, to my followers. So I'm taking part of the responsibility for the quality of your job up on myself. And honestly, I really like for me, it's important for my students to work with my method in a correct way. For me, it means a lot to me. And I do value this system. And I won't just certify people just because they took the course, they pay me money. I love getting paid. There is nothing wrong with it. But that's not enough. I have to get paid. You have to get paid afterwards. Also, very quickly, because I help you to bring clients. And also I need to make sure that it's done correctly. After all, my name is on that certificate and I want to make sure that it's a top-notch work. I'm not being difficult. And remember one more thing, if you're not going to be able to do it within a month, I had somebody recently who came to me after 3 years and she said, I took your course in 2022, you checked, she did, and I would like to get certified. And that time I didn't, but now I think I won. Absolutely. She sent me her videos on Instagram. I checked them. Some of them she had to redo. And after I knew she's doing it correctly, we issued her certificate. So you will never lose your ability to get certified. You're not going to waste your investment, even if you're going to come a little later. It's not that, or a lot later. It's not that big a deal. The most important thing is that you're going to get certified when I saw every move. So our in-person course is slightly different because I'm right there with you. Now, what's the difference between in-person and online courses? Both courses have the full curriculum of online. They have full curriculum sent. They have the chat, both courses. They have the Zooms. Everything is the same. The difference is in-person course has a private session with me for 1 day. 1 day private session with me there. Nobody but me teaches my method and I don't have helpers. I kind of don't like it. I like to see everything myself. Control freak, actually. Maybe it's not a good quality, but at least I know that everybody who works does the right thing. And we do that 1 day and then they go to the online. So you have to do them together. You absolutely have to do them together. If you're planning to fly from Australia or from the Hawaii, I had recently somebody from Europe, do the in-person online course first. It might be sufficient because online course costs $2,500, but in-person course costs $3,800. So there is a difference in price. Plus, you have to pay your plane tickets and you have to pay your hotel. So why don't you do online course first? It's very in-depth course. And some people build the whole practices from online course. That's all they do in the practice. They're very successful and they took online course. Some people after online course decided they still want to have the 1 day in person. And in that case, you just can pay the difference. You don't have to pay everything all over again and come and take in-person course. But it's more cost effective to do online. It's very in-depth and very, very sufficient. And I highly recommend for you to do it that way. Start with online and then go to in person. And now I'm going to answer you all the common questions that people have to me. The second cleanse, I told you, it's not the second cleanse. It's the second cleanse of the facial, not second part of double cleanse. Why do I do lymphatic drainage in the beginning? I told you, because I do not want to release the fluid from vessels and from nodes. I don't want to congest the tissues. I actually want to move the fluid, not congest the tissues. For whom is this facial? For everybody, 17 to 92. Anybody can have this facial. For the young people, it's preventative, and for the older people, it's restorative. Who could not have this facial done? People with acne. People with acne cannot have massage facial done. Now, There is other counterindication, and they're all inside of our curriculum. If person is pregnant, if person has a lymph node removed, if person has a cancer, so many things can happen. All of that is in the PDFs in our course curriculum. You can look into it and you will know exactly what to do. In PDFs of our course curriculum, we also have the intake form, we have a consent form, we cover our students from every way possible. This facial by itself is a very safe facial, but even in addition to that, I like to be safe, so I like to take care of myself from every way possible. That's why we have all forms ready for you, and you can present them to your clients. How do you learn in this modality? We all start in the same time, but you learn in a flexible for your time. That's why after we finish the course already, you have 4 months of chat open. Let's say you're running late. Let's say you had something else to do. It's fine. And as I told you, you can come 2 years later and I will still look at your course and I will satisfy the fact that you want to receive certification from us. Course curriculum itself never closes. The WhatsApp is open 4 months after the training itself, and so are the Zooms 4 months after training themselves. Zooms are very specific. Right now it's very vague, but when we do the course, the Zooms are very specific to whatever topic we are working with. What other question? How often this facial is done? This facial could be done once a week for 6 to 8 weeks, then once a month for 6 months, and again once a week for 6 to 8 weeks. This is when you really need to restructure the face. And then most commonly it's done once a month. But you also can do it once in 2 months, even once in 3 months, and there's still going to be results as long as your client's doing facial exercises. And inside the course, we give you the facial exercises, we teach you how to record them, we teach you how to give them to client. You are completely equipped. By the time you are done with this course, you literally can walk out and open your own business or starting doing this modality because you are equipped with everything from hello to goodbye, and you have our support, of course. Promotions are done only if you got certified. So that is something that I absolutely need to communicate with you, because I don't want you to get disappointed. As I told you, I take part of the responsibility when I promote you, so I need to make sure that you're working correctly. Overall, this modality is extremely healthy, both for the clients and for estheticians. It's very helpful for your nervous system. It's very good for your business because it brings people over and over and over back to you, because now in this modality, you have a project that you do together with the client. Not only you give them facial, you give them exercises, you give them skincare recommendations. Skincare is our separate Zoom. We're talking about skincare. If you are a massage therapist, you absolutely can do this facial. And many of massage therapists that I had started to work only with the face, and we teach you how to do it because you cannot use the skincare. If you're esthetician, of course, you can do this facial, depending on where you are, whether you want to do buccal or not. We teach you how to walk between modalities. You can do it with the buccal massage. You can do it without buccal massage. It depends what's comfortable for you. But I'm warning you right now, with buccal massage, you will always get better results on the client's face. It's for the new estheticians. It's for the seasoned estheticians. It's for anybody who wants to bring results on the client face, save the health of their own body, and grow their business. So this modality is done for 3 purposes: visible result, preservation of estheticians' health, and growth of the business. And that's pretty much it. In our initial live session, of course, I took questions from the people who participated, but unfortunately, because of our technical difficulties, it did not get recorded. That's why I recorded this for you, just to send it to you so you would have it. We will send you also PDF of what I was spoken of today. And I hope you learned something today, even from this brief interaction with me. Thank you so much for your time and for your attention. And if you have any questions, you can write to us on Instagram. Most of the times it's my team who answers the question. If question is specifically for me, they can ask me about question. If question is personal, like what should I do with my own face, I'm probably not going to be able to answer it to you, or it's going to take very long time, because I have a lot of students and my students are my absolute most priority. I have 7 Zoom chats running right now, and all day long I'm on them. So when my team comes to me and says somebody wants to know what to do with her nasolabial fold, I just don't have time to answer it. But what you can do, you can actually go to my Instagram in the story highlights. I have my students who are certified in there. You can go to there, make an appointment with them, and they will take care of you. Everybody who's in my story highlights is certified by me. They know exactly what to do with the faces. Ask them questions and become the client, and they will definitely take care of you. Unfortunately, when we wake up usually to 150 to 200 questions every morning, and most of them we cannot address because there is just no time in the day because of student. If you are my student, that's a completely different thing, that you're going into the private chat and you are always answered. And it's only me who's answering you, and I do not make you wait because I don't like when my girls are waiting for me. I'm saying girls, I have 2 boys actually, two guys. So my girls and guys are waiting for me. So if we don't answer your personal questions, forgive us. It's just because we are so busy. But my students can take you and they can take care of you. Story highlights in your area. If you don't have anybody in your area just yet, it means it's just yet, because we have new students all the time, and hopefully somebody's going to come to your area soon. So I hope I brought some value to you. Thank you for your time, for your attention. Sorry for the technical difficulties. I'm sending you much love. Thank you.